Tushar Wan Kedder. He looks like Messi. Who agrees, then like. Tushar, thank you for your comment. This got my attention because one, I'm a massive Messi fan, and two, I really don't think I look like Messi. Hey everyone, welcome to another episode of responding to your comments. I honestly do think this is one of my favorite series to film. We're gonna be looking at health questions, we're gonna be looking at fun questions, so what we're waiting for? Let's dive in. Infinity numbers. My nose is running like a tap right now. Infinity numbers, thank you for your comment. I'm sure we've all been there. I was actually there a couple of weeks ago as well. This is from the how to treat a cold video. It's also a very common question, well, comment that I get, which raises another question, which is how can you actually stop your nose from running as much? Because we've all been there when you have a really runny nose, you've been blowing your nose all day, all week, you've used like 3 packs of tissue, your nose has gone entirely red and sore. So we've all been there. And as a healthcare professional, the first thing that I always think of is, what's causing this? What is causing this runny nose? You know, because there could be various different reasons that's causing this inflammation in the nose, which is causing a run. And the inflammation, we call it rhinitis. That's the fancy scientific term for it. But it basically just means inflammation in the nose, which is causing it to run. So what's causing it? So for example, when I'm speaking to a patient, a few things that always come to mind are, so what could it be? Could it be viral, the cause of it? Could it be environmental factors? You know, for example, temperature differences. You're going from one room that's cold to a warmer room and it's causing this rhinitis. Could it be bacterial? Could it be a hormone imbalance? There are many different reasons that could be causing this runny nose. So the first thing you need to think of is what's causing it. And by the way, that wasn't a full list. I will leave more information about this in the description below for you if you want to look at the reasons of what causes rhinitis. So the first thing that I recommend to any patient is to speak to their healthcare professional to find out what's causing their runny nose. Whether it's their nurse, whether it's their doctor, whether it's their pharmacist, it doesn't really matter. You just need to speak to a healthcare professional so you can find out what's causing it. Now let's say for the example, for the comment that I've got, this is from the cold video. So let's say you've been diagnosed with a cold and the cause of your runny nose is viral. So the cold is viral and it's causing your nose to run. So for this example, generally speaking, for most patients, I always tend to recommend them a nasal rinse. Now, it's called many different names. Some people call it nasal irrigation, some people call it nasal douching. It's all the same thing. But the beauty of it is that what it's going to do is going to wash away that mucus and any irritants that are in your nose, which are causing this inflammation and they're making your nose run. And the reason that I like this so much is that one, it's inexpensive, two, everyone pretty much has these ingredients at home, and three, it's very easy to do. So it's a win-win really. And the way you do it is very simple. You just get 1 teaspoon of salt, 1 teaspoon of bicarbonate soda, put them in a glass, boil the kettle, and then pour the water in there, about a pint's worth of water, and mix it in. Then let it cool to a sensible temperature that you're not going to burn yourself, and you're going to use this to irrigate. But once again, I'm going to repeat, let that water cool so it's a sensible temperature, so it's cool, so it's probably like body temperature, so it's not going to burn you, so just let that cool. I know I repeated a lot, but you need to let it cool. And now that you've made your great solution, you need to first go stand over a sink, because it is quite messy when you're doing it. Wash your hands first, and then get one hand, form it into like a cup like this, and pour it into your palm. Then cover one nostril like so, and then sniff it up, okay? Sniff it up that one nostril, and then let it run back out. I'd probably say do it about 3 times in each nostril, and then swap over. But if you need to do it more often than that to get more comfort, then do it more often than that, it's not a problem. Now when you do the nasal irrigation, you may end up getting some of this solution traveling into the back of your throat or into your mouth. And this is completely fine, it's completely harmless. If you do get any of this solution in there, just spit it out, it's harmless. Another thing that I'd like to mention is, each time you do the nasal irrigation, let's say you do it once in the morning and once at night, you need to make a fresh batch. You can't use that old batch, so repeat the whole cycle again when you're about to do another nasal irrigation session. Another option, which I'm just going to touch very slightly on, is steroid nasal sprays. They can also be used for a runny nose, for our example, in a cold. But again, I would always recommend everyone speak to their pharmacist first before they purchase a steroid nasal spray, just so they can check that you're suitable and safe to take it, and also so they can advise you how to use it. I did make a video as well not long ago about a nasal spray and how to use it. And trust me, it makes a massive difference if you're using it right compared to when you're using it wrong. So I will leave a link up here and in the description below for you. So if you are using a nasal spray, or if you're using a nasal spray for anything else, I'd highly recommend you to watch it. Thank you for your question, thank you for your comment, may I say. And if anyone's got a runny nose right now, I really hope these tips help you. Thank you. Ingvar San. Ingvar, before I read your comment, I just want to say thank you for your honesty because I appreciate it. When I was circumcised, my dad used to take both shells off and put the powder with mangoes on a spoon. So this is a comment that Ingvar has put from the How to Swallow Tablets or Capsules More Easily video. Once again, Ingvar, thank you for your honesty. But with regards to doing that, because I have heard of patients doing this in the past as well, for getting a capsule, sort of opening it in half and sort of taking the powder inside, I would just always recommend anyone who's wanting to do this to check with their pharmacist, preferably pharmacist because they know medicines a lot better, or your other healthcare professionals, because certain medicines you can do this and certain medicines you can't do this at all. So please, 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 always check with your pharmacist before anyone opens up a capsule and pours the content, whether it's on a mango, whether it's on yogurt, whether they're mixing it in water, anything like that, just check with your pharmacist first. But thank you for your comment and thank you for your honesty. But if anyone thinks I look like Messi, leave a comment below, let me know. But if you don't think I look like Messi, also leave a comment and let me know. Or maybe let me know who I do look like. A few times people have said I look like Everything Apple Pro. That's probably the most common one that I get. I'm a massive fan of his, by the way, but I still don't see that resemblance either. But if anyone's got a good resemblance or a good lookalike, let me know. Thank you for your comment, Tushar. Have a great day. Elichi, which is easier to swallow, a capsule or a tablet? Elichi, thank you for your comment. This is from the How to Swallow a Tablet video. It really got my attention, so I thought I'd mention it in today's video. It really depends on the size. So firstly, if you've got a massive capsule and a tiny tablet, obviously the tablet will be easier to swallow. But then you have different sort of shaped tablets. So you have a normal tablet, which is circular, but then you have caplets, which are a capsule shaped tablet. And a caplet, generally speaking, is a lot easier to swallow than a tablet. So that's another point to consider. And then lastly, tablets, you have a film coated tablet and a normal tablet. So a normal tablet is sort of powdery on the outside, whereas a film coated one, the best way to describe it is it's like a Smartie. So you have Smarties and they're sort of like film coated on the outside and they're smooth. And that's what a film coated tablet is. It has that sort of outer surface on it that makes it smooth and easy to swallow. So that's a really sort of long way of answering your question, but thank you for your comment. Once again, it looks like we ran out of time. I really enjoyed interacting with your comments this week. And if I missed your comment, I am really sorry. We get so many comments, so it's quite easy to miss a few. So if I did miss it, please leave another comment. I'll try my best to get back to you in a future episode of responding to your comments. Always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.